This report tutorial is to assist you with the interpretation of the dried urine test for comprehensive hormones, the Dutch test, specifically for the cortisol portion of the test. When we're looking at cortisol, typically it's easiest to start with the free cortisol pattern. This is usually the information that's gleaned from saliva testing, and that's one of the most unique features of this test is that we're able to look at the cortisol throughout the day in the free fractions. So the first value representing the cortisol while you're sleeping during that overnight period, and then 2 hours after waking up you collect, and that value represents what in a normal situation is that surge of cortisol in the early morning. And then you've got an afternoon measurement as well, and a measurement around bedtime. So in a case like this, you can see that those values are relatively high throughout the day. So we want to evaluate that for dysfunction as it relates to the patient's symptoms. Now, once we've done that, then we take these four values and essentially combine them, not by just adding them up, but by using some math to try to figure out what best represents the day's total for free cortisol. And that's this value up here. So think of that as a 24-hour urine-free cortisol. So we have the individual measurements, and then an approximation of a 24-hour total for free cortisol. And then we also have this value down here, and that is the metabolites of cortisol. You can see how big those numbers are, and that's because that's where most of your cortisol ends up. Not very much is represented in the free form, but the free form is the most important fraction because that's what gets in to the tissue to do work. The last piece of this is the cortisol-cortisone shuttle, which just shows the balance between active and inactive cortisol. So we're looking at all the cortisol metabolites, and if it's deactivated to cortisone, then we can look at all of those metabolites, and in some cases that can help clear up what's going on in a particular case. Now, here's sort of an opposite case where the free cortisol is very low all day, the 24-hour value for free cortisol is very low, and the metabolites are very low. So here's somebody that's just not making cortisol. So if you're making way too much cortisol, you could have a serious issue. If you're not making any cortisol, you also could have a serious issue, and those you want to evaluate very carefully. The reason that this test is so valuable is because we can also see these cases where it's kind of a mixed bag, where in this case, the free cortisol is very low the whole day. And so the 24-hour urine-free cortisol is low. So from that, it's tempting to assume that cortisol production is low. It means that circulating cortisol is low, but in this case, production is actually high. Production is best approximated by the metabolites. Free cortisol is only 1% of the total. The metabolites represent a much higher fraction of the total. So what this type of result implies is that the free cortisol, the circulating cortisol, is low because cortisol clearance is so high. So yes, you're making a lot of cortisol, but the cortisol is being cleared very rapidly. And that's where you get these sorts of results. Obesity, insulin, long-term stress, high thyroid, hyperthyroid can lead to this type of result because all of those things really increase the clearance of cortisol. Now this is sort of the opposite case, where the free cortisol is relatively high throughout the whole day. So if you're looking at a 24-hour urine-free cortisol, you're going to get a high result, from which you might assume cortisol production is high. If cortisol production was high, the metabolites would also be high, but they are not in this case, which implies that this clearance of cortisol in this case is sluggish. That's not happening as rapidly as it normally is. Now, in a case like this, when we look at the cortisol-cortisone shuttle, we notice there's a big favoring of cortisol. And in those cases, you can also look on the first page of the adrenal report and see also not just free cortisol, but free cortisone. And often in cases like this, there's not cortisone being made to the same degree that cortisol is being made, because that's sluggish as well. Now, the cases like this are most common with hypothyroid, with low thyroid, because low thyroid, and the literature is pretty clear, leads to cortisol not being readily deactivated to cortisone and not being pushed downstream to those metabolites. So the interpretation is that it appears that the free cortisol, the circulating cortisol, is elevated because of sluggish cortisol clearance, not because of an excess of production. So in cases like this, you can still get a lot of symptoms of high cortisol, but it may not be because the adrenal glands are making an excess of cortisol. So in those cases, you need to think through very carefully, what's going on with the patient. In cases like this, it might be even a little bit more complex yet because the free cortisol doesn't have a consistent pattern. So here the free cortisol is high in some points and low in other points. And we have to be honest with the data in knowing that we don't know exactly what's going on with the cortisol in between. And in those cases, the metabolites might shed some light on that as to whether the overall production of cortisol is actually in excess or not. But there is incomplete information here. The free cortisol pattern here could drop off very rapidly and bottom out rather quickly, or it could stay elevated for some time before descending to that low result. And so we need to piece all of this together when we're trying to best evaluate what the patient looks like with respect to both their circulating cortisol as well as the cortisol production as we try to treat the patients with respect to the cortisol.